Preterm babies are susceptible to many diseases like respiratory distress syndrome, intraventricular hemorrhage, and necrotizing enterocolitis. Though these diseases develop later, the management to decrease complications and mortality should start just after birth. So in this video, I will talk about immediate management of the preterm newborn just after birth regarding delayed cord clamping and hypothermia. I will talk more about cardiovascular and respiratory support in my next video. So first, the basics. How do we define preterm babies? Those who were born before 37th weeks of gestations are all called preterm babies. In pediatrics, those babies are categorized by weight. So the normal range of weight for a newborn baby is between 2.5 kilogram to 3.5 kilogram. However, if the baby is below 2.5 kilogram, then the baby is called low birth weight infant. If the weight is below 1.5 kilogram, then the baby is very low birth weight infant. And in case the weight is below 1 kilogram, then the baby is extremely low birth weight infant. Of course, the less the baby weighs, the more the mortality will be. And as you can see from this table, preterm babies are susceptible to many diseases. However, with appropriate intervention at birth, these complications can be minimized. The first step is delayed cord clamping. Then, what is delayed and what is not delayed cord clamping? Early cord clamping means clamping the cord when there still is blood coming from placenta to the baby. However, if we delay this to the point when the circulation between the baby and the placenta stops, then this is called delayed cord clamping, DCC. So usually early cord clamping is clamping the cord within 15 seconds after birth, while delayed cord clamping occurs within 30 seconds to 3 minutes after birth. So the placenta contains blood that amounts around 35 to around 40% of total fetal blood. So delayed cord clamping can allow extra blood to flow to the baby. If cord clamping is delayed for 3 minutes, it means around 100 milliliter of blood has been transferred to the neonate. And as you can see, neonate can receive more blood from placenta if the cord clamping is delayed. The result is less transfusion for anemia, less intraventricular hemorrhage, and lower risk for necrotizing enterocolitis, NEC. As can be expected, the hemoglobin level after delayed cord clamping was much higher. And the side effect is, yes, bilirubin concentration was higher as well in this group. In case of term infants, not preterm, delayed cord clamping do not have benefits in mortality, so it is not a necessary step in term infants. And some of you may know cord milking, that is essentially milking blood in the umbilical vein to the baby. This can give approximately 20 or 15 milliliter of blood. However, this is not recommended since it can raise the risk of intraventricular hemorrhage. And hypothermia. After birth, the neonate can easily fall into hypothermia, that is below 36.5 degrees Celsius. Since the baby has larger surface area per body weight and the baby is wet, meaning the baby loses more heat from evaporation. So this is really dangerous since 1 degree Celsius drop in baby's temperature means 28% increase in mortality. And hypothermia is especially more dangerous for a very low birth weight baby and extremely low birth weight baby. Hypothermia has been known to raise the risk of lower Apgar score, that is, below 7, and intraventricular hemorrhage, late onset sepsis, hypoglycemia, and respiratory distress. So it is important to maintain the body temperature of the newborn, and also hyperthermia is not good as well. Therefore, the ideal body temperature is between 36.5 to 37.5 degrees Celsius. I'm sure that many hospitals are equipped with products or devices to prevent hypothermia, including plastic wraps, bags, plastic caps, hats, warmers, and so on. And of course, room temperature should be around 26 to 28 degrees Celsius. And medical personnel should be all educated about how they receive a newborn, where they put the newborn, and so on. There are actually many more supports that newborns should receive even after birth, including respiratory support, cardiovascular, or nutritional, and so on. I will further talk about this in my next video. Thank you for listening.